Hello, Professor and fellow classmates. Welcome to my last presentation on osteoporosis, subtitled Adolescent Education Can Help Old Bones. Osteoporosis is a disease that weakens bones, making them more prone to fracture. It takes place over time and has been called the silent disease. It's estimated half of all women sustain a fracture related to osteoporosis, and it causes an estimated $12.2 to $17.9 billion per year in annual costs. The current testing procedures, although recommended, are somewhat beneficial in predicting low bone density or fracture, but certainly not 100%, and it doesn't help prevent. It only helps diagnose and attempt to try and limit the fracture potential. 90% of peak bone mass is formed by age 18 in girls. Bones are stronger than ever by age 30, and building strong bones in youth is the best way to reduce the chance of osteoporosis. By building a strong skeleton early, it helps to sustain bone mass through your middle age and into your latter years. Some of the nutritional impact for osteoporosis is calcium. Calcium is found in all bones. Calcium is essential for bone health. Its deficiency in youth accounts for the decreased peak bone mass and risk of fracture later in life. Once again, we approach the topic of what you do early will affect your latter years. Diets rich in dairy and protein is key to assuring appropriate calcium levels. Milk, cheese, yogurts, all are key sources of calcium nutrients. Vitamin D helps to absorb calcium. Sunlight is the best source of vitamin D. If you can get out into the sun 10 to 15 minutes, 2 to 3 times a week, you'll get the recommended vitamin D you need for your body. And sunlight's the best source, but foods such as dairy products or vitamin D pills are other options. Reducing osteoporosis risk: eat a healthy diet with calcium and vitamin D. Perform exercises regularly, but they need to include weight-bearing exercises, things that are going to have resistance against gravity. Walking, running, weight training, Tai Chi, just to name a few. Avoid smoking. It decreases estrogen and adds to bone loss. Studies have found that as estrogen levels decrease, bone loss also decreases. Alcohol limits calcium absorption, as well as makes somebody unsteady and more prone to fall, and takes steps to limit your fall risk. Those with osteoporosis falls can result in hip fractures, wrist fractures. 15% of women with osteoporosis will sustain a hip fracture. This is a telling statement. The annual number of osteoporotic fractures in women is greater than the number of heart attacks, strokes, and cases of breast cancer combined. With those staggering statistics, it's surprising that we don't know more about osteoporosis and it's not more in the mainstream. And with the statistics suggesting that peak bone mass is gathered early on in life by doing weight-bearing exercises and eating the right foods, it's odd that there's little education on adolescents and young women to build that peak bone mass. And evidence suggests the best way to prevent osteoporosis post-menopause is development of bone density before the age of 30. At the age of 30, your bones will be the strongest they ever will be. So it's keen to educate early, put forth the effort early, and provide yourself with great bone density well into your golden years. Where should the change happen? Education must be multi-tiered. Nutrition and exercise needs to be promoted in young girls and women in schools. Social media campaigns to reach adolescents and young adult women. And the primary care physicians need to focus better on educating younger patients. This is not an old person's disease. This is a woman's disease, from young girls all the way up through the elderly females. It's one cyclical pattern. By doing things early, you help yourself later on. And the primary care physicians need to take hold of that. Education in schools. According to author Charles Duhigg, routine builds a habit, and the brain will generally go into autopilot, incorporating the learned behavior. Developing a healthy habit must be learned early to provide for the most benefit in osteoporosis prevention. by teaching proper health, physical activity, building that into someone's everyday diet and everyday routine. By doing that over and over, you'll develop that habit, which will hopefully carry over through their lifetime. And incorporate the education in the middle schools, the physical education. School lunches, they should offer options high in calcium and vitamin D, and encourage regular physical activity and programs to teach young girls to participate in daily weight-bearing activity. Continue to develop healthy habits by promoting osteoporosis prevention for adolescent women into their teen years, when that peak bone mass is rapidly developing. By schools developing curriculum and teaching more about osteoporosis is certainly going to have substantial benefits. Campaigns such as Girls on the Run, walking clubs, Tai Chi, and yoga that adolescent women may find interesting and carry over to post-high school. It's very important. Teach in middle school, develop through high school, go through college, go into their adult years. These are programs, not necessarily sports and athletic clubs, but these are just clubs that people can participate in school, outside of school, different classes. And again, it's weight-bearing activity that builds that bone density, and any activity that someone can incorporate into their daily lifestyle and carry over through their years is important. And schools is where it's going to be most effective to teach these habits. Offer guest speakers discussing osteoporosis testing processes, how osteoporosis can affect quality of life, and along with the morbidity and mortality risks. Many young people don't know about osteoporosis. Having a health professional come in and teach about osteoporosis, suggest what happens to women in their 60s and 70s, how much a hip fracture can impact somebody's lifestyle, and all the health concerns that come along with it. Most young women don't understand those, and by having someone come in and be able to discuss this disease can certainly have a substantial effect on how they live their life, and hopefully they change some of their habits. Mandate physical education programs, meeting sunlight exposure 15 minutes twice per week, with the emphasis on schools and their physical activity programs to help with the osteoporosis. By just taking those programs outside just twice a week, we get the recommended vitamin D, which again helps absorb the calcium, and the calcium in the bones helps create strong bone density. School officials and teachers, coaches, club leaders, they all need to be educated on osteoporosis prevention. It's important that obviously they're well in tune, and they can then help lead young women in prevention. And the curriculum should be revised to incorporate osteoporosis prevention in outdoor activity. Another part that certainly needs to change in osteoporosis awareness is a social media campaign. By utilizing social media, you'll be able to reach a large audience rather quickly. Social circles could support and encourage each other to become or stay active. By sending out the message via social media, hopefully it'll exponentially increase from there, and people will become more aware. Hopefully they'll do more research. They'll support one another, encourage one another to come out and become involved in physical activity, eat the right food, share recipes. The benefits of social media are phenomenal. And young women become aware of the risk and how nutrition and physical activity will help minimize the risk later in life. Postmenopausal women are in the greatest risk bracket. Postmenopausal tends to have the sharpest decrease in bone loss, bone density loss, and by taking advantage of social media and putting that out there, reducing the risk of continued bone loss and fracture through education, peer support would have substantial benefits. Communicating the message, internet, radio, television, newspapers, magazines. There's so many different outlets. Variety and dispersing the message is ideal. Frequency, just as in the development of habits, allows media messages about osteoporosis to become readily accepted. Think of your favorite commercial. You might not have known it the first time, but the 25th time you heard it, you can probably sing the jingle. That's the important part about communicating the message frequently in multiple different outlets. Continued exposure, build momentum, exponentially increase awareness, prevention, research, treatment. The more often it's talked about and discussed, the more power players, politicians get involved in osteoporosis awareness and prevention, the more attention will be devoted to it, the more research and treatment options. It certainly has a lot of benefit. And the physician's role. This is one of the greatest changes that could happen, is for physicians to use their knowledge that they have for treating the elderly, and redirecting that, teaching their young women that osteoporosis is a young person's disease. Young person's disease in that if you don't take action before you're 30 in those critical times of developing that peak bone density, you'll have no option to increase that bone density through life. It starts to decrease after 30 and substantially at menopause. So physicians need to educate adolescents, young women, the risk factors, ways to strengthen their bones, and ultimately minimize the risks later in life. Just to wrap up, osteoporosis, serious concern for women of all ages. It impacts women later in life and can only be prevented by the actions taken many years earlier. Schools must incorporate education about osteoporosis, nutrition requirements, and daily exercise. It's optimal that schools become involved, that programs be developed in schools. Starting at the ground level is the greatest change that can happen for osteoporosis prevention. Social media can be a very effective outlet to reach young women. Various other media outlets allow for diversity, ability to reach women of all ages. Physicians need to be involved to assist in education, prevention, and treatment, and only by incorporating a multidimensional informational campaign will women grow to learn about the silent disease and how they can impact their future today. I found a variety of references on osteoporosis and osteoporosis prevention. These are just a few examples. Thank you for tuning in. I appreciate it, and I hope that you learned something.